Kevin, we're good to go.
Yep, you've been given the green light.
All right. So call to order. I'd like to get a motion on the floor for approval of the minutes of 9:20. Motion, please. Anyone?
Oh, motion.
Oh, I didn't read it.
Thank you. Molly?
Second.
Okay, all right.
Who's taking minutes?
Karen, are you able to take minutes?
I'll take the bare bones.
Bare bones, that's all we need.
Okay.
So Molly made the motion and Linda seconded. All those in favor, please say aye.
Aye.
Any abstentions or nays? Thank you. All right, we're going to go right into it. So we're going to have Kim McNamara, Health Officer for the City of Portsmouth, come back to us and give us an update on the Community Health Assessment.
Let me bring that back up.
Can I be heard clearly with this mask on?
Yes.
Just make sure you're as close to that microphone as possible.
Yes, ma'am.
Thank you.
Okay, I just wanted to update you where we are with the community health profile. We've run into some glitches. So an RFP was posted on August 10th, and responses were due by the 30th, and we actually closed it on the 9th without any successful candidates. We only got two. One was over budget, and the other one was significantly focused on senior health care issues. You know, they're from that industry, and that's what their forte was. And it would have eaten up a huge part of our budget for travel because they were out of the state, quite far away. So we've come back to the drawing board, and there is a recent service area needs assessment. I think you all might have actually gotten a copy of it. Goodwin Health put this out, or Greater Seacoast Community Health put this out. It has a lot of good information in it, and some of the demographics that we're also interested in. But I did want to point out that there's a little bit of difference between a healthcare system community health profile and needs assessment and a community health. What we're looking at overlaps much of what they've been looking at, but we're really looking at factors in our environment that can be taken action on by municipalities and by service organizations such as yourself, you know, to use the information to go after funding or for whatever other changes need to happen. So, could I have the next slide, please, Karen?
There we go.
Thank you. So, we're breaking this down into three manageable phases because the feedback we got from the people who didn't apply but who know New Hampshire very well is that they don't have the bandwidth with either staffing or with time right now to do the whole thing. However, a few did say if it's broken down into smaller pieces, we might be able to pick up one or two of the pieces. And so that's what we looked at. I'm working with our contractor, Dr. Tori Jennison. Some of you may know who she is. She's very knowledgeable about public health in New Hampshire. And she and I have been going through this together to figure out what is the most effective way and efficient way of doing this. And this is what it seems like. The demographic and community health data profile, or phase one, we'll really be having a contractor look at the data sources that are existing. They're just going after the demographics that explain and describe Portsmouth residents, and so we get an understanding of the overall community. And we'll get more into what they look at in just a minute. And then phase two is the community health needs assessment, which is we look at the environment and the health, and this is where our social determinants of health come in so that we can understand the risks and related disparities that exist. And of course, phase three is the community health improvement plan, and using the information gathered through the first two, and with heavy stakeholder input, we will develop a community health improvement plan with an equity and inclusion lens. And this can guide investments and interventions, including non-monetary items such as policy or legislative recommendations. We're also looking at how much we can do in-house. We do have some talent in-house, although it's well hidden sometimes, but we might be able to take on a chunk of this and relieve that worry. Next slide, please, Karen. So during phase one, these are just some examples of demographics and health data that we've already identified to look at. And there's quite a few more than this, but I wanted to give you an example of what we're talking about. So for demographics, things like age, education, income levels, foreign-born residents, persons with disabilities, what our population growth trends are, race and ethnicity, and migration. And then health data is the standard ones that you look at. And we have most of these we have a set of health data from the 2007 regional study. Well, that was 5 or 6 towns, and we might need to use 5 or 6 towns again because of the sparsity of data, or it might not be on that granular a level, or it might reveal too much. And so if you have only so many cases of something, you don't want anybody identified, and so you might combine it with a region and get more information that way. You know, there are also things added to this like suicides, gun violence, domestic abuse, overdose deaths, hunger, you know, the things that we talk about and are concerned about. So it's pretty broad. Can we have the next slide, please?
Excuse me, will we have access to the paper that you have, a copy of that, to be able to study this a little more?
Well, I can provide you access with anything I have, but I'm just reading the slides here.
Okay.
We can email this afterward.
Just,
So, the community engagement strategies should include, but they're not limited to these groups. These are groups that we initially just identified, that we know that this is our vulnerable population. We know the emphasis of ARPA funding to, you know, some portion of it is on public health disparities. So these are the groups that we have included in what we want statistics for and what we want to look at. However, there are going to be other groups that are identified through the stakeholder meetings, through the phase 2 and phase 3 process. And if anybody feels that there's a group left out, please email me. I'd love nothing more than to add that to our list because it's important. And the next slide, please, Karen. And then the Community Health Improvement Plan. This is where we really get into the social determinants of health. When we're looking at that, you know, we're worried about where people are born, live, grow up, all these things that are listed here: education, neighborhood and environment, healthcare, economic stability, and social and community context really heavily influence people's health. And this is where the equity piece comes in, and the inclusion piece. You know, we want to look at everything with a lens through these items, but we're really focusing on who we identify as our vulnerable populations with this in mind. So, as I mentioned before, some of the outcomes may be policy or legislative recommendations to this. Sometimes by just changing how we do things is more important than, you know, if we have a certain amount of money attached to it. So there are some non-monetary recommendations, I assume, will come out of this. So that is where we are currently, and I'm happy to answer any questions.
Questions?
So given that there wasn't a company that can perform this task within the budget, how did that impact your timeline, with your expected timeline, I should say?
Well, we tried to shorten the timeline to fit with this task force timeline so that we could give you the information and you could, you know, digest it and develop recommendations. But there's no one that says that they could have done it in the 6-month time except for one inappropriate company. And so we're going to have to extend that, whether or not we're doing it this way or if we were to go back out for another RFP. What we're hearing from our vendors is that, look, we can do this small piece of it, you know, and so if we divide it up in chunks, I think the timeline's going to be actually shorter than if we try to go with another RFP, because we can be doing work on phase 2 while they're crunching the numbers somewhere, because the data that is going to be developed for the profile is common data that everybody has access to. So, you know, there's nothing special about going to a state website and pulling stuff off. There's something a little more special about analyzing it. But so we're going to try to get it done in a reasonable amount of time. But the most important thing is that it's quality and that it really tells us from local input where we need to go with public health in the future.
Just to follow up on Laurie's question, because I think that obviously we want to create a situation where you're feeding us as much information so that we can have a really good conversation and make recommendations to the city council. But I think that, you know, the timing in terms of getting the profile done and so forth is not aligned with our timeline now. So the question is, if we get to December and we have to make recommendations, I mean, we can always ask for an extension, but the question is, if we do that based on where you are with your process, what I'm wrestling with that because I don't know where we're going to be in December, and it may be that you may be significantly out in terms of getting the assessment done and so on and so forth.
Well, one of the things that is difficult for people is the final report writing. You know, some people wanted 2 months to do that polished final report. We're going to learn an awful lot between now and December about our vulnerable populations, just by the work that we're already starting to do. We're just going to be breaking it down. So I think that by December, if we don't have a good chunk of good information for you, Karen's going to not be happy with the health department.
No. I think to both your points, it would behoove this group to be patient and get the right data, and we can just provide an update to the council. In a perfect world, we're making recommendations in the same time frame as ARPA. You know, they'll hold us in abeyance for consideration of ARPA funds. So
Yeah.
I'm not worried about December,
Yeah.
and I think if we give the council the update on where everything stands.
So you're saying give the council an update if depending on where we are, and then if we have to ask for additional time, we can do so?
Oh, I would, yeah,
Yeah,
absolutely.
yeah.
They
Because
would not
I
say
would
no.
assume that the council would say, well, you know, what you're doing is really critical to all of this, so it's important to have that.
Absolutely.
Yeah.
They won't enforce an artificial deadline that doesn't make any sense. Certainly if that's our recommendation as a group.
We are receiving information already and some data already, and so it should be coming in at a pretty steady stream from now until December, and we should be able to do quite a bit of work with that data to get it to a format that's clear and to you folks, and you know, that's to understand the situation. We're also seeing a lot of the same themes run throughout things: transportation, childcare, living wage, no staffing. And so those are running across the board. So if we know transportation is a common issue, maybe this group could work on transportation for all the various people that you represent.
I was going to say that I don't think there's going to be any surprises out of the process that you're going through. I think the vulnerable populations, we know what those are. We know we've already identified what challenges exist. And if we think back to our last meeting where we were talking about really looking at themes, City Council will want that data at that granular level. But I don't think what you're doing is extremely important, but I don't know how impactful it really will be to this group, because we already know, we just don't have the exact specific data, but we already know what the populations are and what the challenges are.
Well, I was going to say, though, given what I'm assuming this program does, is pretty incredible, and that you're having a contractor, right, who's going to work with you doing this. That's what you mentioned.
That is the hope.
Yeah.
Yes.
Right. But you already know the most important issues in terms of everything that you just showed with us. It's just that you want to really look at it in, inside the, everything that you need to find out to make sure that you're making the right decisions about what's most important and stuff, which I can't imagine that we don't already know what all those issues are. We just need your
Well, I think a couple of things. One, what the work that Kim is doing is important for a number of reasons. One, to verify what we're seeing and what we're hearing. Also, I think, going back to what I mentioned earlier, that the City Council probably will want to see that. I don't see them moving forward without the input of this report. I mean, this report, I think, is important to the decision-making body for the city, because it's a community health profile, and so it verifies the conversations that we're having. So for those reasons, I think that this is important. Now, to Kim's point, we can continue to have our conversations, our discussions. You're going to come back and you're going to continue to inform us as you learn information, so that hopefully by December, we are well informed and aligned, and we can go to City Council and say, look, we've worked with the health department all along. Kim has been keeping us abreast of what she is learning, so that, yes, we may not have a study or report to give you for you to give us a report at that moment, so we can then include it in our assessment. But I think we can make it work. To Karen's point,
One of the parts of the community needs assessment is a narrative. And so, in my mind, that's one of the most important pieces, and that's where we get the local information. We're going to be starting on the narratives. So we're going to be meeting with groups that serve certain vulnerable populations, and we're going to be starting to write those. And, of course, it'll be as succinctly as we can, but we also want it to be accurate and such, and those are going to tell us an awful lot. So those are going to begin. That's not going to have to wait for anything else. The other point, Nancy, is I agree that we already know the global picture, but I can tell you from when doors began to open again after COVID, the health department found a lot of surprises as far as people who have been left without services for a couple of years, without oversight. The state services that they used to meet with in person then went to Zoom, and you can't really tell as much in Zoom. So we've had some surprises, and one of the surprises to me is, how do people fall through the cracks so badly? And I don't know the answer to that. That's something we should know about, so that if it's constant case management that is needed in that situation, that we have that in place before the next COVID comes along or the next disaster of some sort.
Go ahead. Will this report inform how the funds will be dispersed to those 13 or 14 applicants of the?
Yeah, thank you. I'd like to clear that up a little bit. So what I requested was people use a form that kind of matched sort of the ARPA outline as it unrolled. They weren't technically applications, they were pieces of information, and I gathered them so that we had started this process. And I got those from some of our most strapped providers. And it's a kind of a nice overall mix of different populations that we're talking about here. So there hasn't been anything official, and I actually, when this group formed, I sort of turned all of that stuff over to you. As far as a dollar amount, some people have written out dollar amounts, but we've also had some of those agencies fold. We've also had some of those agencies find other alternative sources of financing, which is great. Some of them are doing programs where, for example, we have a daycare that is having a great struggle. They're working with a high school for kids to be trained in daycare, services, but the kids aren't of working age yet, and so they need a little bit of bridge. So there's all kinds of different scenarios, but I think this group has been talking about more, just saying these are our priorities. You got to look at this stuff, and don't worry about the dollar amounts, but don't ignore them, obviously. But I liked that conversation. I thought that was probably the most effective way to go.
And I had a conversation Kim just prior to starting the meeting, and I know that some of you were asking for those requests. She's of the mind that we should not be sharing these because they were really not official applications or requests. They're in different states of writing, and so for those reasons, I think that, and for the reasons that Karen just stated, I think that we ought to not distribute those.
Well, they weren't written for public release, so they're very draft and rough. But you do have the information. I provided someone with some figures about, what's been requested so far, and that changes because of these changes that go on in these programs. But it's not, that's just, I have provided Will with a summary of what the needs were identified, and so he has that. And that was taken from all of those.
And can I scan this and share it with the group?
I think so.
Okay.
I'll take a quick look at it. I don't think there's anything confidential on it, but.
Okay.
Is that list closed at this point?
No, it was really for my gathering
Right.
information so that I could go through my chain of command to let people know.
Would you like more?
Well, let me.
Turning that over to you folks.
Well, let me speak to that. So at the ARPA work session, we pledged to develop a comprehensive running list on the website. So it should go live either today or tomorrow. We're just working
okay.
out some fine tuning. So it would include all the department's requests. It would include requests from groups like the Housing Authority. And it will also include the requests that were made at that time. And I think it would be incumbent upon the groups to confirm whether those are still valid. And it will be archived in such a way that the newest requests will show up and the older ones will file down. So that's a today, tomorrow, certainly end of the week exercise. That'll be on the city's website.
If I could just add to that. So the requests that came in were all very valid and made great points. The ARPA rules were not completed by the time those came in, and so whatever you have may have to be rewritten for the ARPA language, but they're all still fit under ARPA. It's just, that's another reason not to release them, not to cause any confusion.
Well, and the other thing, too, is that there's a bit of a misalignment between those early requests and what we're talking about here now, because we're talking thematic as opposed to individual organizational need. Now, there may be space for that in there for our recommendations for individual organizations, but I can't speak to that right now. I don't think any of us could.
Ultimately, it will be the decision of the council if they use
Exactly.
recommendations of this group in conjunction with specific requests.
Exactly.
Well, and I would think if we go forward with our recommendations or our ideas for what we were tasked with and base it on the themes, then City Council might say to an organization, we're recommending mental health for children. Anybody have, that need or could come up
Right.
with a program? So I think just for us not to get too bogged down in like dollar amounts and who's asking for what, it's
Right.
like looking at the themes, what are
Yes.
our ideas? As we collectively work together, we're the ones working in the field.
Yes.
And saying, well, this could be helpful, that could be helpful, and ultimately, City Council will find the organizations that are requesting it or vote on it, because
Right.
that's their, ultimate decision. But
Right.
so otherwise, I think we could get so down the rabbit hole of that, instead of really looking at, well, what are our ideas? That's why we're here. We're the ones in it every day.
Yes.
At
Thank
the
you.
last meeting, someone had asked the question how the health department came up with the figure of $3 million. And I wanted to explain that because that is not hard. This is what we need. The ARPA rules, when they first came out from the federal government, there were 4 main uses of them, and one of those uses is public health disparities for populations that are most affected by COVID. And I just took, being simple, $12 million, a quarter of that is 3. But my concern has been, and this is the last time I say it, I promise you, but it would be a shame if we go through all this work and we have all these people come to the table and do the work of sharing and digging for figures and everything, and then we don't have any money left to do anything with. And so I would like, and you may have recommended this, I don't know, but I would like to have money saved for the end of this process so then we can really take care of the vulnerable populations that we're charged with.
Question. What falls under public health? So like, does transportation fall under public health?
Well, it could. It depends on if you're having public health issues for people because of transportation. So like, we don't generally fix transportation issues. We bring it to the attention of people who are better in that world, and when there's support, they can fix it. Or, you know, the people who need to maybe spend money on it can, but just about everything touches public health.
When was the last time one
Lori.
of these?
Lori.
When was the last time one of these plans was done, a community health?
Well, we have a profile, but that's not actually a plan. I don't know that one has been done.
Okay.
How old is the profile? 10 or 20 years?
2007, the
15.
profile was done, and that was done through the Public Health Network. There are, as I said, the service area needs assessment is good. Wentworth Douglas Hospital's coming out with their own community health profile. I know that that's Dover, but we're in their catchment area. So there's good information if you read through there to just see what people are up against, and, you know, more from a clinical perspective, but they do go into other issues.
In terms of the narratives, sorry, can you give me an example, like just a really 30,000-foot example
Sure.
of like what that narrative would contain?
So here's a narrative. There's a local daycare that has closed down 1/3 of its program because it can't find staffing. The families are calling the daycare because they're desperate to get back into the workforce. Some of them may be professionals that we need. Some of the, you know, we have huge service area industry here. I'm sorry, service industry. You know, we have a lot of medical facilities here. So the narrative would state, this is the problem, this is how COVID affected it, if that's the case, and this is what we see as a need in order to overcome that. So that's a very basic example of a narrative. The point of having all the input is so that it can be written far more eloquently than that.
That will be really helpful.
Is that the one from Community Campus that was closed down?
No, that's a local daycare.
That was a local one closed down, and many
Only
parents,
1/3 of
I
their
worked there
program,
for a
but-
while, and parents were really concerned about that.
Yes.
Right.
Yeah.
Felt that it should have continued.
Well, I don't know if we're talking about the same one, but the point is we're seeing that. We go to do daycare inspections, and we find, you know, 1/3 of them or a half of them closed, and it's because of
Yes.
staffing
Yeah.
issues. Right?
And that goes to the theme thing, because if we talk about, I know that workforce has been mentioned a number of times in the past, and if we have gaps, if people are not able to get back to work because of daycare, I mean, that's a big problem, which contributes then to possibly mental health issues and other kinds of things. So it's something for us to think about for sure.
That's where the narrative is very important, because we don't know if we can get those numbers specifically. Sometimes it's a 2 or 3 year delay in employment numbers and things. So that's where narratives are very helpful. They tell the story and they tell it accurately. It's just they don't have this data bank that we're drawing on. Hopefully we'll.
Well, I personally, I would love to get at, if we could get at more anecdotal or better information on people that are not able to get into the workforce because something's keeping them back from it, whether it's childcare or mental health issues or transportation. That would be fabulous. I mean, we keep on hearing about it, but we really don't have good numbers on it. And I don't know if that's something that, in terms of when you do your profile, you can try to get at.
We do have those issues, things like daycare and employment data and everything on our list of wishes. So hopefully we can find a vendor to go after that.
Okay. We need to move on to Patty, but how often do you think you should be reporting back to us we meet bi-weekly, so do you want to come back bi-weekly or on a monthly?
Well, I'm not sure if in 2 weeks I'll have much, but certainly after that, every 2 weeks, we should have quite a bit to discuss.
Okay, so we'll schedule for 2 weeks from,
For a month.
4 weeks from today.
Okay, great.
Thank you.
Thank you.
Great.
Thank you.
Thanks, Kim.
Thanks, Kim.
And next up is Patty Ann Ardizoni.
Artizoni.
All right, who is Director of Communications for Southern New Hampshire Services, which is also Rockingham CAP.
Rockingham Community Action, that's right.
Thank you for coming.
Oh, my pleasure. It's so much fun sitting in a room listening to all of the things that I deal with all of the time, and that the conversation continues to be alive. As Pam was talking, she mentioned Tori Jameson, who was such a huge cog in the Integrated Delivery Network project that Nick Tumbes for our region headed. And I believe that having her available will help fill in some gaps of those numbers, how to crunch them. Maybe, I mean, she is so brilliant, she could probably use what the IDN work dug up and forecast it forward to give a good. I mean, COVID was not a thing when we were deep in IDN, but again, I think that she's just so expert that she'll be able to look forward and give you a good guesstimate of the numbers. So I was happy to hear her name mentioned. Also, I think that for me, and I was just talking to someone from Granite United Way today, whenever I need to go to a community assessment to get some kind of backup, the United Ways were always very good at keeping that kind of information alive. Again, we keep going back to COVID as being not an excuse, but certainly a barrier to what always had been happening kind of by default. So I don't know where they are with their community assessment, but Lauren Wool from Greater Seacoast, I am sure would be able to say quickly yes or no, this is what we have for numbers. And part of their pillars, their 3 pillars, were certainly childcare, those kinds of resources. So again, they may well be a quick go-to for some information that they have logged somewhere. I think my role, I was able to speak to Will briefly this morning on my way into work. Just to give you a quick background, I started with RCA, I think it was 17 years ago, and at that time I had no idea what community action was. I had my son and needed to get back to work, and there was a job posted in the Hampton Union for a part-time community relations-y kind of role, and so I went and I applied and entered into this world of I was just saying to Nancy, it's the best kept secret. Unless you need services that CAP provides, you would never know that it existed. And it truly is one of the most valuable doorways to capture, I think, any household or individual who finds himself in some kind of place of hardship, because you need heat. We see homeless all of the time. I want to get back to work. Can you help me? I need to find an apartment. It's really the information and referral place that people just kind of default to. And because we work so closely with the welfare departments, and I mean, I work really closely with them, happily, the people who are experiencing crisis are steered to whichever community action, nationally, I hope, makes sense for them. So as you're working towards this conversation that I've kind of gleaned a little bit from listening from the sidelines, I think that a lot of what can inform your work, I may have the information that I can send to Will. The numbers for Portsmouth is something that we keep tallied in terms of how many individuals and households receive all of the services that we have, and what the value of services would be to the town if we didn't have the federal funding. right now we're experiencing, and it's no secret to anyone, the emergency rental program. People are attritioning out of their 18 months that benefits would have been a help to them. And now they're calling our office. I spoke to Ellen before I came in here, met with the new welfare person in Kingston, and she's seeing a significant uptick in calls, which we knew would come. Up until now, people were not walking into welfare offices. We saw almost no traffic in our food pantries. It was as if life had just frozen for many people, and for many reasons. I think some people were laid off and not brought back on. Some people decided that's not what they wanted to do, and they were looking for something else. We've heard that. You know, it was the Great Resignation that we were calling it. And other people who really always needed hand-holding. My allergies are, I know, very attractive. Always needed hand-holding, took that opportunity just to hide and just kind of hope things were going to work out for them. And instead of saving whatever money they could while they were getting benefits, they had extra money, so they weren't going to the food pantries and taking advantage of that and leveraging. They were spending the money. And I think that's what we're going to see. And we're going to see a tsunami across the country of this, not just Portsmouth, not just Rockingham. I think we're going to see people saying, now what do I do? And then the answer is, oh my gosh, what do you do? You know, let's for us, we would say, let's back up. Are you on fuel assistance? Do you need electric assistance? You know, kind of go through all of those same questions to try to stop the backward movement, provide the supports. If we do not have the supports in-house, make those community partner connections with our community partners who are out and about and who are doing the good work. And it's going to feel like, I think, for a little bit of time that we are juggling everything. And the good and the bad of it is it gives us an opportunity to maybe reconnect with community partners that, because of the pandemic, we've all kind of siloed ourselves, but we can come back in, we can invite people back in for workforce, and I don't have to tell Will about that, but the community colleges and trying to find kids who are going through school to come into our workforce. Try to figure that out with what is it that you want to do conversations again, connecting people in ways that they probably never thought that they needed to be connected. If you've never had to ask for help, you don't know what you don't know. And I'm not talking about the long time low income people. I'm talking about people who have, I mean, my husband was laid off. People who have never had to grapple with, how do I fill in the blank. So that's a very broad brushstroke. But if you all have questions, I am more than willing to take your lead and try to fill in some gaps.
You mentioned Kingston and Welfare Department.
Yes.
There. Can you extrapolate that to more of a general scene across municipalities in the welfare departments, where they're going to be, as you
Sure.
say, be seen a tsunami of individuals
Sure.
who are all of a sudden come out of places, they've been hiding, they've been using services, but now the services are going to run out or resources, and they're going to find themselves in a place where they're going to need
Right.
a helping hand, but it seems like systems are going to be overwhelmed, if I'm understanding you correctly.
Systems should not be overwhelmed. They should be flexing back to their healthy working status. The way that we work with welfare, and I'll give you a very brief overview. If someone calls us, we will immediately say, have you reached out to Portsmouth? Have you reached out to Ellen Tully? If they have not done that, we suggest that they do that. At the same time, we will say, what kind of program are you interested in? And largely, it's fuel assistance. So once Ellen makes contact with the Portsmouth resident, she does have daily contact with our office. Between us and Ellen, we will say, and my motto is always this: use our money first, always. We've got federal funding for so much. My job is to make sure that the municipalities in Rockingham County really understand that it's not lip service. We are here for them, and we are here to be good stewards of the taxpayers' money. So why would I want Portsmouth to pay the whole nut for somebody for fuel when we've got it? And Ellen is, to your point, Will, going to have people who are already a part of fuel assistance. They already are connected to all of the service supports that they should be, but it's not going to be enough for them. Or something is going to happen. I mean, their water heater will die, or something is going to happen that is not neatly tucked away in one agency's purview. So that's where that relationship between a welfare office and community action, and again, I hope nationally this is true, where they come together and say, what is it that we can do? More often than not, it will be and Ellen Tully will say, I can't pay for their last month's rent. So if you can handle that, then I can, in good faith, do this. And it truly is. That conversation might bring in Women's Aid. That conversation will bring in SHARE. Whatever it is that we can do to gather the right people at the table to not put a Band-Aid on someone's problem, but to actually solve it is what we want to do. And by being that conduit to draw those conversations all together, we continue to inform what it is that's presenting to all of us so that we can hopefully kind of get ahead of it or prompt a conversation. I've seen a lot of people coming through and they are whatever it is, and we need to talk about that. And do we have the right people at this table? Should we draw other people to this table so we can either take on that programming as community action or find a good home for it for someone? Because we don't want to duplicate anyone's efforts. Years ago, RCA had Meals on Wheels, and then when Meals on Wheels got really healthy, we were happy to say, let us know who you need fuel apps for, and we will support them that way. So I think number one, continuing the good conversations and communication between all municipalities and community action agencies. Not because I'm a lover of community action, but because we do represent those basic needs that people have, without which they've got that white noise in their head and they won't want to listen. They can't listen. So to keep that really good communication going, Portsmouth gives us some money through the CDBG funds. The interesting part of what's happening with the emergency rental program is many Portsmouth residents have gotten benefits through that, and we haven't had to use the money that we've gotten through Portsmouth. As people transition out of benefits, Portsmouth residents are going to be very present in needing that CDBG money, as well as our discretionary funds, which you probably have seen the Gift of Warmth that's published every year. That came out of a awful time for RCA when the longtime executive director was gone, and the executive committee thought they could be the executive director. And for those of you who know, it was never going to work. So of course, the papers became alerted to it, and Howard Altschuler came, and I brought him. At the time, we were in this building on the 3rd floor, and fuel was in the morgue. And I brought him down to them, and they used the body. I was telling Nancy, we used the body drawers for filing cabinets. It was, and the ghost is George. But I knew that we were dealing with two different things. We were dealing with a board issue, but programmatically, we were amazing. And so when I brought him down to talk to the staff in fuel assistance, he sat with everyone. We walked out and he said, could you use a campaign? If we could raise money for you, could you use a campaign? And I thought, and that, my friend, is how this works, that when you're able to really affect people's lives, it shows, and he walked out of there understanding that you talked about the narrative of it all. That's wonderful because the stories would break your heart, but also he understood that this truly was moving the needle and that there was need for discretionary money for people who were helped. But if you're a penny shy of eligibility, you are no less in need than you are if you are eligible. So the welfare community action relationship is significant, and it's significant in every way, because that is where people and need is presented. You'll get the weirdest phone calls, and I want them, because I would rather have somebody call and say, I've got a client, Bureau of Elderly and Adult Services. We work very closely with them. A pet, the person needs to go into the hospital. What do we do with their pet? Or they need food. They don't have money for food. All of those little things that never land on paper or on a city report. That's what happens. And anyway,
I hate to cut it short, but are there any questions for Patty?
and I am always available. I am always available to come in and sit with any of you if you want more information. Again, I've got the data. I can bring data to you. I sit on the Governor's Council for Housing Stability, so I've got that information as well, and I'm also the co-chair of the Balance of State. I can bring that information to you as well. Whatever it is that would help inform your process, I'm available.
Thank you.
And maybe this will clear up by then.
Patty,
Seriously, please.
I do have a question.
Yeah.
So please reach out.
I do have a question, Patty. Do you have any estimates as to how many individuals will end their 18-month ERA this winter, and whether or not and how you'll use discretionary versus city welfare funds to keep them housed?
That I don't know about the client numbers. I don't have access to the database. But I will tell you, regardless of where someone or why someone presents to us, we don't have apartments that we can house people in. But we certainly have had people who are presenting saying, I am either going to be invited out of my apartment, or I do not have a home. Working with 211, and this is a conversation for a whole other time, the state is working very hard on something called coordinated entry, which means that if someone truly is at risk of being homeless or they're homeless, they would call 211. They would go through a short list of identifying where in the scale they are truly, like Maslow's hierarchy of risk. And there's something called a prioritization list. They would be bumped up. If they were the 100th person calling that day, but they were the most at risk, they would be bumped up on the list and go to that regional access partner who would work with them. So our work with that person would be to make sure that they are connected, not given a phone number, but that they are connected with whichever appropriate agency, entity, whatever it is. And if that's calling in Ellen, if it's calling in Will, because this person has no place to live, whoever it is, to make sure that this person is safe while we can work with them is what we will do. So the rental program aside, we would look at someone presenting as no more, no less than a human being who happens to call Portsmouth their home and we would help serve them. Tangentially, what's happening is New Hampshire Welfare Association is becoming very vocal and aware that people are being housed outside of what their last city of residence was. And how are they going to work together? Because there are towns who have already submitted their budget for this fiscal year, and they did not think that people were going to be flooding into their cities and towns. And this conversation is happening everywhere. But wherever these people are presenting, the Community Action Agency is going to be working with them. It will look different at different counties, but we will always be working with them.
Okay, thank you. Thank you, Patty,
You're welcome.
for coming on such short notice.
No, my pleasure.
Very helpful. We don't have a lot of time for just general discussion, but I'll open it up to thoughts, comments, questions? Anything we learned today that continues to move us in the right direction?
I think it's reinforcing that what we've been kind of thinking all along is being proven.
Right in there.
I think perhaps at the next meeting, we should talk about a timeline. I love hearing from the people doing the work. That's, validating. But at some point, we're going to have to shift from continuing to validate what we already know to how are we taking this information, putting it together in a package to be able to present it to the council.
For me, it was interesting to listen to Kim and to Patty, and for both of them, I saw kind of a theme, and that is that there are people that are not in the workforce for a variety of reasons that at some point will come back to the workforce, hopefully, but that are going to encounter significant obstacles. And those are hopefully, and those tied to the themes that we've been talking about, whether it's transportation or daycare or mental health or anything else. And so it continues to validate the conversations that we've been having. And for me, that it was good today to hear that because we can come back next week and begin, to your point, to have a little bit more meaty discussion on what we've been hearing and what we've been discussing. So at some point, to your point, we do need to get to the meat of it and begin to have the kind of conversation among ourselves to get to some decisions.
I had invited Zach McLaughlin for the superintendent to come next for the 18th.
Okay.
So he said he can come. So I don't know if we want to think about, he could present, so we have that one more piece, and then maybe we spend the rest of the meeting really looking at the trends and where we go, really laying it out, because it has already been the end of that's the last October meeting, and it's like November, December.
Yeah.
So then maybe we could spend more of the meeting laying out the agendas almost for the rest of or where we're going to be in December, or hope to be.
I was interested in what she said about the food pantries and stuff like that people had backed off. And it makes me wonder if, with all the stimulus checks and rental assistance, if that isn't one reason for the lack of workforce. Because people felt like they didn't need to work so much.
Yeah, that's part of it.
So, yeah.
But at some point, that's going to run out. And if you're not engaging and looking for work, and then you continue to have a problem without the resources that they've been getting. So it's going to have an impact. Karen, I don't know if you have a perspective on this from what you just heard from them, because it seems like...
I was fascinated and encouraged by what Patty Ann shared. And what this group should know is the welfare department and the welfare portion of the city budget is the only section of the budget that is allowed to spend more money than is allocated in the budget. No other department can do that, and that's a state statute that every community can do that. Ellen Tully is the unsung hero of city staff, in my opinion, and she knows where all the patties are and all the resources are. So maybe at a future meeting we could hear from Ellen as well, not on the 18th. I think we should leave it for Dr. McLaughlin and timeline, but keep Ellen in your thoughts.
So Dr. McLaughlin's already been invited?
Yes, yep. I invited him to this one. He wasn't able to come, but he did confirm with me last week he can come on the 18th.
Okay, great. So we'll put him on the agenda.
Because if we're going to try to come up with a fix for the workforce housing, lack of workforce, like you said, we really need to understand exactly because we were talking about the idea of having some of this ARPA money go to sign-on bonuses to get people, but maybe that's not an issue.
Yeah.
We don't know what is going to bring people back to work.
I wonder if there are social, counselors and stuff that are reaching out to these people who maybe have not been working for a period of a year or 2 years, whatever, during the pandemic time, and need some help to get back into the workforce. And from my speaking with some people, that was mentioned. They don't know where they're going to go. and how they're going to go about doing it. You know, and however they survived is with all these different programs that, you know, help them, whatever, pay their rent, get their food, whatever. And I just wanted to share, I go back to community action all the way back when it first started, and worked with families in Seacrest Village. If some of you remember Seacrest Village years ago. And it was a program out of UNH, a program out of Community Action. What she was talking about now, that's what existed then,
Yeah.
in the early 70s and stuff.
Okay, we've got to
So, and I'm just
cut it
saying
short
that I'm.
because
Oh, and I have
Karen and we all have to get back to meetings.
And I have to leave too. I have another
Okay, and you have to
meeting.
leave, yeah.
I do, so thank you very much. And
Okay, any
Exciting.
public comment before we adjourn?
Do not have anyone on Zoom. and
Okay.
There's no one in the room.
Great, so I'm entertaining a motion to adjourn.
Oh, no public comment?
Lori motioned. Who seconded?
I'll second it.
Thank you.
Thank you. Oh, time goes by too quick.
Thank you.
Crazy.